Hello everyone, I am Dr. Neha Gupta and I welcome you once again to Feminine. Feminine is a channel where we talk everything about women's health. So we are talking about the very important topic of emergency contraception. I have discussed about EC or the emergency contraception in one of the previous videos, and we are going to carry forward that discussion in this video. Just to brief you up, I had mentioned that there are two options for the emergency contraception. One is the copper IUCD and the second is the tablet or the pill that we take by mouth, which is commonly called as the I pill. So, and what time frame are these contraceptives applicable? So, the I pill should be taken within 72 hours of having unprotected intercourse, and the copper IUCD is able to work up to 5 days after having unprotected intercourse. When we talk about their mechanism of action, so the I pill or the tablet that works by preventing or inhibiting ovulation. Ovulation is the process of the ovary releasing the egg. So the I pill inhibits ovulation, whereas the copper IUCD primarily acts by preventing fertilization of the sperm and the ovum. Talking about their failure rates, so the I pill or the LNG pill, which is to be taken within 72 hours of the unprotected sex, will prevent by and large 90% of the unwanted pregnancies. The copper IUCD, however, is the most effective form of emergency contraception with a failure rate of less than 1%. Now coming to the next question. Are there any medications or supplements which, if taken along with the emergency contraceptive pill, are going to have an effect on its efficacy? So yes, there are some drugs, some antibiotics which we call as the enzyme inducers. So these medicines, for example, we have rifampicin. Rifampicin is one drug which is a component of the anti-tubercular therapy and a very commonly used drug. So rifampicin, certain anti-epileptic medications like phenytoin, these are all enzyme inducers. By inducing the liver enzyme, they increase the drug metabolism. So if the emergency contraceptive pill is taken along with one of these enzyme inducing medications, then the efficacy of the I pill can go down and the chances of its failure may increase. Similarly, if any progesterone tablet has been consumed in the 5 days prior to taking the I pill, then that can also reduce the efficacy of the I pill. Also, I'd like to mention here that if somebody is very obese or overweight, that means if their weight is more than 70 kgs, or if the BMI, that is the body mass index, is more than 26, that can also reduce the efficacy of the oral contraceptive pill, that is the I pill. Being overweight or obese, however, will not reduce the efficacy of the copper IUCD. So those are the things that one has to be mindful of. Now what if you're not aware, if you're already pregnant and you end up taking an I pill? So I have mentioned about it also in the previous video that I pill, whatever data is available, the data does not state any major side effects of the I pill on pregnancy. The I pill mostly does not lead to any congenital malformations in the baby, and it is safe to continue the pregnancy even if you have mistakenly taken the I pill while you were pregnant and you were not aware about the pregnancy. Of course, as the pregnancy advances, we do the level 1 ultrasound, which is to screen the developing baby genetically, and then we do the level 2 ultrasound, which is to look at the proper formation of the various organs of the baby. All the required tests and the investigations, they will be advised to you. But yes, if you have taken the I pill while you are pregnant, then it is safe to continue with the pregnancy. Now the next very frequently asked question is, how long does the effect of the I pill last? So if a lady or a girl has unprotected sex again in the same cycle, then will the I pill give her protection? Then the answer is no. The I pill will not give any protection for any further episodes of unprotected intercourse in the same menstrual cycle. If you have had any episode further on in the same cycle, then you can repeat the I pill. The I pill can be given again actually within the same cycle. But one single intake of the I pill is not going to provide protection for the entire duration of the menstrual cycle. Another question that I am asked frequently is, how soon after taking the I pill can one start with regular contraception? So actually you can start with regular contraception right away. So if today you have taken the I pill from the very same night or from the next night, you can start taking the birth control pills, which is a regular form of contraception which has to be taken one pill every day. It's a pack of 21 tablets, so it has to be consumed for 21 days, and then a gap of 7 days needs to be given, and a new pack after that needs to be started. So yes, the regular contraception can be started immediately following the I pill intake, but the pills, for them to be effective, at least 7 consecutive pills should be taken, the first 7 pills. Only after that the contraceptive protection of the birth control pill gets established. So it is important to use some additional form of contraception like a condom, that is the barrier method, for the first 7 days of taking the birth control pills. Beyond that, you can just safely continue on the pills itself. And yes, if you had got the copper IUCD put as an emergency contraception, then that itself will act as an ongoing contraception, because the copper IUCD has a life of 3 years, some of them have a life of 5 years. So if you've put it for the purpose of emergency contraception, you can just let it be there and it will keep on providing you ongoing contraception as well.